Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a weekly series airing every Friday. This is a space for our opinions where we talk about current events and questions the Latino community is curious to know. Today, we are joined by co-director of New Hampshire Family Voices, Terry Ohlson-Martin, who has worked at the organization for about 33 years. Previously, she has provided training on special education, early childhood issues, and more. Welcome, Terry, and thank you so much for joining us.
Thank you for having me.
It's a pleasure. We appreciate your time. I was hoping to kick off if you could give us, our audience, an introduction to New Hampshire Family Voices and discuss its core mission.
Sure. So we are a family-to-family health information center. We're a parent organization, which means that the majority of us are parents of someone with a special healthcare need or a disability. And it also means that our board of directors is also made up of the same population. We offer families support and assistance figuring out the New Hampshire service system and how to access any kinds of services or supports that they need for their kiddo. Our mission is really to make life easier for the children and the families in New Hampshire who have any kind of special need. We have a lending library with over 2,500 books for families. We publish documents. One of them is called Maneuvering Through the Maze that really helps families to understand the service system from early childhood up through, well, our population that we receive funding for to serve is to 26, but as we've gotten older and our kids have gotten older, we can answer questions for even over that population. We also work in system development, trying to make the system more family friendly. We work with a lot of the professionals who are responsible for running the system and for setting it up. And we try to impact that hopefully before the system is established so that it doesn't end up having, we don't find problems after the fact.
Right. Thank you for that. That's a lot. I'm wondering how the pandemic has affected the organization's operations and services this past year.
Well, we did learn how to pivot pretty quickly, along with the rest of the world. Initially, we worked with the state to make sure that families had access to what they needed. There were some families who were finding that they weren't able to quickly get, not even quickly, but just routinely get the things that they always had to have, whether it be rubber gloves or masks. These were not unusual things for many of our families to have in their homes, but they quickly became very popular with other people. So we worked with the state to try to facilitate that. Many of us started sewing. I've made far more masks than I would have expected, but we were sewing masks and collecting them from others who sewed them and sending them out to families. So we did some of that hands-on stuff, but we also had to think about kind of the broader picture on what we were going to do going forward. So we changed how we do trainings. We do everything virtually now. We don't go into the office. As you can see, I'm in a bedroom in my home. We do have a staff member that goes into the office once or twice a week to mail things out because we're still mailing out our books from the library, just not doing it every single day. We've put different books on our website. So we have quite a few books around COVID-19 for children because lots of kids had questions and concerns. So we changed that. We've done trainings around telehealth. We have a person who's really good at doing Zoom meetings. If you want to run a really great Zoom meeting, she can tell you how to do it. She can support a family with trying to access their doctor's appointments. So we've tried to focus on things that families are needing now.
Right.
It's a little different, but it's working.
Right. That leads into my next question. It's how the pandemic has greatly impacted the New Hampshire families your organization serves. What have been some of the biggest challenges for children and youth with special health care needs and or disabilities this past year as well?
It so depends on what their need is. For families, for some young people who really need that socialization, it's been huge because they can't, and all children need it, but there are some kiddos who I would say need it even more, that they're learning by observing and being part of a classroom and having those day-to-day interactions. They're learning things that for other kids may come naturally. So that's been really hard. There are also children who have and young teenagers who have significant medical conditions that mean that they really can't be in school even part-time. And when you're a teenager and you cut off your social arm, that's horrible. So that's been really hard. We have a youth group. It's youth education, advocacy, and healthcare that meets monthly, and those kiddos have become a real support system for one another as they're doing their work to try to improve the system for young people in New Hampshire. I think that for a lot of families, we do everything by Zoom now. The problem is they do school by Zoom now. They do telehealth by Zoom now. People are getting really sick of constantly being on the computer. So that's kind of put a little hurt to some of our trainings, but I understand it. It's the way it goes.
Right, exactly. Doing the best you can with the situation.
Yeah.
So this is then a bit more broader. It's what the organization's its biggest goals have been in 2020, and what are some of its main objectives going to this new year?
Well, probably the newest thing that we're working on that I'm really excited about is around child developmental screening. And we have something called a centralized access point pilot. And we'll be working with family resource centers and others in New Hampshire who are serving young children so that families can do a developmental screening online. And then based on the results, if there are any needs identified and a family should be connected with services, we're going to make sure that those families get those connections. And there's kind of that closed loop referral. The state has been looking to gather that kind of information to make sure the families are actually getting what they need. You can do a screening, or you can get an evaluation or any sort of thing done, but it's really what happens afterwards that's important for making the difference for a child. So we're really excited to be working on that.
Did the pandemic influence this new resource in any way?
It's influenced how we're doing it. It hasn't really influenced what it is. There's been a lot of work in New Hampshire going around early childhood through a funding source called the Preschool Development Grant. That was a federal grant. And so we're really looking closely at how the early childhood system is set up in New Hampshire, how it's responding to families, how we're making sure that we're including families from diverse backgrounds. We want to make sure that the system is accessible for everyone. So it's been really fun.
How do you manage that, the idea of accessibility and, making sure you reach out to communities that might not see these resources as easily as others, reaching marginalized populations?
It's not easy. We have partners. Sometimes we think we're getting really good at it, and then you kind of hit a stumbling block. We've worked with the Office of Health Equity, and they've been helping us. So for instance, we've been trying to do a survey to make sure we're reaching all the different populations. We had the surveys translated into Swahili, Arabic, Spanish, and there were two others, which of course aren't going to come to me right now. But so you've got these surveys, you've got them translated, but how do you connect to the families? So we worked with the Office of Health Equity, and they have a lot of really good contacts in some of those populations, and they can get those things into the families. It was important to us because we were able to offer them a stipend, and we wanted to make sure that they got the stipend just like the other families that we reached out to did, and that they were able to participate, because we think we're creating a system that's good for everybody, but we might be messing it up.
Yeah, it's hard to tell. It's only time sometimes, but just wow, that's important. Yeah, I can imagine the struggle, especially right now. Everything's already different.
Yeah, we have trouble reaching out to our neighbors, never mind anybody that you're not close to.
Exactly, absolutely.
Yeah.
So I read that you've been a part of Family Voices for over 30 years, and I'm wondering if you could talk about the organization's growth and general journey throughout your time there.
Sure. So my co-director, Martha Jean, and I actually started it in New Hampshire. I was originally working at the Parent Training and Information Center, which in New Hampshire is called PIC. I was there as I was training in special education, and I was also working on a project around healthcare. I started working with Martha Jean on a project, and we had national friends that were working on developing an organization that we thought was going to go away once we had health insurance for all. That didn't happen. We didn't go anywhere. But what we really wanted to do is to make sure that all of our families who had kids with special healthcare needs had access to sufficient health insurance. That was a number one goal at the time. So we worked with the national organization, and we worked with local funders, and we were able to get enough funding so that we could become the statewide affiliate of Family Voices, which is the national organization. Things have expanded over the years. We've done a lot of different projects. We've been able to work with different partners. We have a much larger staff. I actually just onboarded a new staff person this morning, and we have somebody else starting next week. We try to hire family members who have someone with a special health care need or a disability in their family, because if you live it, you know it, and it's much easier to work with families and for them to feel that connection. I remember having a family say to me, "Wow, you sound like you're okay." You had a recent diagnosis, and I'm like, "Yeah, I'm fairly okay." Some days we question it, but we will get through this, and you'll do fine, and your child will become a really great person.
Oh, that's sweet. Absolutely. I'm wondering, how can New Hampshire residents get involved or stay updated with the organization? What are different ways they could do that?
We would love for them to check out our Facebook page. They can contact us through our website. We strongly encourage people to borrow books from our library. Right now, we're not doing any events, but who is?
Right.
But I would encourage people to check us out, contact us if there's anything that we can do to help them, or if they have any, even any ideas about systems work that they'd want us to know about. Please let us know. If there's anything that we can do to reach out to other organizations or other individual families, by all means, that's what we want to do. And our phone number is still answered. We've actually had it forwarded to a staff member's house. So we try to get back to people we try to get back that day. We're doing this little Facebook thing, so she answers the phone and reaches out to us and who can call, and to try to make sure that we're continuing to be very responsive to families. We don't always get back in the same day, but usually within 24 hours, we can get back to a family.
That's good. That's amazing. Yeah. The accessibility is important, that easy to reach time. So you're still, okay. So it's mainly remote, and you're functioning with this new almost hybrid model.
Yeah, it really is. We've tried to figure out, so my phone number actually forwards to my home, which is sometimes inconvenient because people get the number wrong and get a phone call at midnight, but
Right. Yeah.
it's okay. It's important to be there for families.
Absolutely.
So that's what we're doing. And a lot of people reach out to us through Facebook. We do have a private New Hampshire group. If you have a family member or child with a special healthcare need, you can join our group. And that works out great because they can talk to one another. So if a family is looking for a provider, they can go online and say, I'm looking for a neurologist in the area of Dover. And different family members can come in and say, oh, try this one, or, oh, I like this guy, or, because we don't all have the same requirements for a provider. We like different things in our providers. Martha Jean and I have always laughed because we had the same pediatrician, but we did not necessarily have the same neurologist. And, we had different expectations, and who I would really enjoy, she would not enjoy, and vice versa. So
Gotcha.
you can't say this guy's really good, so everybody should go to him, because that's not true.
Right. The online community is such a great resource.
It is.
So thank you so much. We're running out of time, but it's been such a pleasure with you, Director Ohlson-Martin, and for being our guest on NHLN Opinion Plus.
Thank you very much.
It's been a pleasure. I hope to see you soon.
Thank you.
Okay. Everyone, please tune in next week for another episode. Follow us on Twitter at NH Latino News and Instagram at NH_Latino News. I'm Belen Dumont with NHLN Opinion Plus, and I'll see you all next time.